Matilda, and I was very happy to hear that your party is committed to a national pharmacare program. Since I think it was the Romo report. Mr. Romo mentioned about the need for a national pharmacare program. Many years have passed, and I'm wondering, as many others are wondering, what's the hesitation in terms of the National Pharmacare Program? Why is it taking so long? And could you comment on how your party will implement a national care program if you can?
Thank you. I'm not going to tell any stories about how long I've known Clotilda, but I do want you to recognize in this room that we have here with us a real hero in this province and nationally. Clotilda has the Order of Canada, the Order of Nova Scotia. She was the first Black woman to graduate as a nurse in this province. Cleaning up the city tar ponds back in the day. Our pharmacare plan, the pharmacare evidence is overwhelming. There was a Romo report is still relevant. A very recent report by the leading experts, some from U of T, one from UBC, Steve Morgan is his name, so people who like to go look things up, if you look for Steve Morgan, UBC, Pharmacare 2020, you'll find all the data that proves that the fastest growing cost in our healthcare sector is the cost of pharmaceutical drugs. That pharmacare as applied in other countries, they compare the prices of a prescription for a drug in Canada to a prescription for a drug in New Zealand. We're paying hundreds of times more than we should. When you look at the evidence, it's overwhelming, and I asked myself, and I started asking people like Steve Morgan, why have we not done this? Big Pharma. The pharmaceutical lobby is huge, and they really are. Is the camera still here from CBC? They're really greedy bastards. They are. So, how do you do it? How do we handle it? What do we do? We need a nationally sourced buying program, because it turns out, I mean, as much as I think the pharmaceutical lobby is aforementioned, I discovered how was it that when they were fighting, they're immoral as well as greedy, fighting the provision of HIV drug cocktail to Africa. They were not making it available at a price that any African nation could get. And then Clinton Foundation went in and negotiated a bulk purchase price that brought the cost down from unaffordable to pennies. Turns out when you deal with big pharma and you give them the money up front, which is when they want to see it, and it's predictable, they'll bring the price way down. The other thing we need to do is do away with the very generous protections for intellectual property for pharmaceutical companies so that we have many, many more generic substitutes. The last piece to this that I want to bring into the picture for pharmacare, there's something at the University of British Columbia called Therapeutics Initiative, and what they do is they're the gold standard for studying the registration package that drug companies bring forward. And they study it to determine, will this drug help more people than it kills? I mentioned this earlier. Tens of thousands of people in North America die every year taking prescription drugs as prescribed. So we don't want to just buy everything that Big Pharma puts out there. They also run campaigns, by the way. Every time you see something in the newspaper, somebody who will die unless they get this drug treatment that costs $20,000 a month, and there's this big lobby going forward to get that drug for this very sympathetic individual. Those are public relations campaigns run by the drug industry. And the reason that that drug price is so outrageous is because their claim is that they have to recover all of the blood, sweat, and toil of their brilliant scientists coming up with this research for life-saving drugs. The truth is, and this was published in the New England Journal of Medicine a number of years ago, a study that said, basically everything they're bringing to market is a small tweak on an existing invention. They're not having to recover lots of research prices. This is just their public relations science. So we need to have what New Zealand does, which is also important, to make sure that people aren't being overprescribed with drugs that are counterindicated for each other. New Zealand's Pharma plan includes that every pharmacy has a cross-reference immediately to any other drug, regardless of what doctor prescribed it, regardless of where they got their prescription filled, so that we can actually reduce the numbers of drugs that Canadians are on that they shouldn't be on. But when a Canadian needs a prescription, no one should decide, I can't afford to fill this prescription, so I will go without. So it's urgent, it should be done now, and the only reason it hasn't happened is the lobbying power of the pharmaceutical